According to the online journal of Issues in Nursing, nursing is constantly changing. They state rather than nurses running around in starched caps and skirts, depending on physicians' assistance, nurses are now independent men and women of diversity. As students, I am here today to inform you of nursing and how it is a constantly growing and evolving work field. There is one thing about nursing, though, that is never changing, and that is its foundation of caring and compassion. I have expertise in this area from being a registered nurse for 4 years and for the formal research I have done on this topic. Throughout their day of medication passing, education, and wound care, nurses are constantly incorporating caring and compassion. They also serve as a platform of promoting God's values. This brings me to my first topic. Students enter nursing because their desire for caring for others. Auburn University did a study on 78 nursing students. They concluded that 2/3 agreed that caring is essential in nursing. They also included that altruism, or making a difference for others, is top motivation for a nursing career. They included the work of Cook, Gilmore, and Best, and have concluded that students' desire to help others is a major aspect of why they choose nursing. Now that you understand a little bit of why students choose nursing, this brings me to my next topic. Patient-centered outcome is benefited most by caring and compassionate care. Dr. Lowndes, a world-renowned cardiologist, has done much research on this topic. His studies have shown that compassionate care, often in the form of attentive listening, creates a healing relationship with patients and improves diagnostic clarity, patient outcomes, patient adherence with difficult treatment regimens, and brings immense gratification to the profession. He also states that it is impossible to provide patient optimal care without the basics of caring and compassion. Now that you have a greater idea of how caring promotes and benefits patient outcomes, this brings me to my final topic. Caring is essential in nursing. The importance of compassion is reflected in the Institute of Medicine's definition of patient-centered care, which emphasizes the key dimensions in relationship to patient-centered care include compassion, empathy, and responsiveness to needs and values, and expressed preferences in coordination with the benefits of including family and friends in patient outcomes. They also performed a study which included the works of Goodrich that showed and proved that in combination with physical care, when compassion was included, it proved a better outcome for the patient and patient compliance. This brings me to my conclusion. Registered nursing is a growing and constantly changing work field. Even though it is hard work and takes a lot of dedication, if you want to have a job that not only fulfills you mentally and physically, but spiritually, then nursing is for you. I hope that I have informed you enough on the different sides of nursing, and if you feel that caring and compassion is driven you by God to be your commitment in the work field, then nursing is the job for you. Thank you.